Stillwater's Morning Scramble. Glad to have you here. It is a Wellness Wednesday brought to you by Stillwater Medical Center. Appreciate that. And also Simmons Bank. Every show, they're our title sponsor. Appreciate all the work both those do for us. And Dr. Drew Anthony is in. Good morning and nice to meet you.
Hey, good morning. Glad to be here. Thanks for having me.
This is an odd way to meet you, though, because we didn't get to shake hands, which is...
That's right.
When it's first time or whatever, you feel like, hey.
Kind of... It is sort of awkward. It's always awkward, seeing patients and stuff. We don't usually shake hands and that kind of thing either, which is a hard habit to break, I've found, during this time period. But getting there, I think it's helpful. And avoid contact wherever necessary.
And we're both wearing masks here. John was wearing a mask, and John's stepped out a little bit here. We're trying to limit the contact and stay apart a little bit, which is hard to get used to.
It is. It's tricky, but...
I mentioned to you because I was cleaning up over there. We're trying to sanitize the best we can here. And you said how you were in contact when you're with patients every day.
Correct, yeah.
And for the people that are, say, doing the testing, which you're not doing the testing, but how does that work when they're in contact with someone who thinks they have COVID? Mm-hmm. And then, they're going to have to be doing the same thing in 5 or 10 minutes.
Right.
What do they do between times?
So in a testing center like that, if you're, just doing repeated testing on people that we suspect have COVID-19, you are going to be wearing a mask. They often, in a testing center, are often wearing face shields and that kind of thing, not just a mask, maybe even goggles. And then they also wear gowns and gloves, and they change those every time.
Every time they do.
Patient, yeah.
I thought they probably would.
Mm-hmm. Yeah, no. That ideally, in an ideal situation, you have disposable gowns and gloves, and you change those for every patient that you see. But in addition to all the normal things, washing your hands, there's no substitute for good old hand washing. So I'm sure they're doing that in between seeing patients and that kind of thing as well. But those are kind of the standard things to do in between.
Life's changed, huh?
Somebody.
Yes, do you have any idea? I know I'm veering off, and you may have been warned. We do that sometimes.
That's all right.
Do you know how many are tested per day here?
I don't know off the top of my head. I haven't. I've been in practice here just for a month, and so I'm still kind of trying to get set up and things like that. I do kind of keep aware of what's going on. But I'm not aware of our monthly testing numbers off the top of my head.
Right. Let's talk about your practice, because you're at Stillwater Medical, the Physicians Clinic, which is on 6th.
That's right. Yep. I believe 1815 West 6th Street, if I'm not mistaken. But,
that's what I wrote down,
okay,
too.
Good. So I hope that's the right number. But
well, Joy Haken, she provides me information.
Okay,
and stuff.
Good. She gives you a heads up.
Yeah.
So she can help keep us both straight, hopefully. But
before we dive into your practice, let's reminisce a little bit. And
sure.
People in Stillwater.
Absolutely.
You're a Stillwater guy.
Yeah, I'm a Stillwater kid for sure. I was born in Stillwater Medical Center in 1982. So grew up here.
Oh, they can do the math now.
Yeah, no, that's all right. They can figure it up. But grew up here, went to Westwood Elementary. Anybody that knows, my folks are longtime Stillwater people and have been around town for a long time. I worked in Tiger Drug for my dad,
right.
For years as a young man and stuff like that. I went to OSU for undergrad. And
did you know at that time what you wanted to do?
I actually, when I was a little kid, I wanted to be a marine biologist, but I don't know what changed somewhere. I switched to wanting to go into medicine. Actually, also thought about being a pharmacist like my dad, but ended up chasing that medical degree and ended up going to Oklahoma State University. But I always for a long time, I knew I wanted to do something healthcare related.
Yeah. And where did you practice right out of the chute? When you
right
left Oklahoma State, what was your next stop?
My next stop was Oklahoma State Center for Health Sciences for medical school, and then I also went to residency at OSU in family practice there in Tulsa.
Very
so that's
good.
Where I've been for the last 3 or 4 years, working in the Tulsa area. Which is, I really enjoyed Tulsa, but I always kind of wanted to come back here. We've got a 1-year-old son, and
wow.
So I wanted him to I've got a lot of family around town, and me and my wife, whom I also met while I was working at Stillwater Medical Center as an undergraduate, we ended up wanting to come back, like being in Stillwater.
Home, isn't it?
Yeah.
Stillwater is addictive.
Yeah. It's I like Stillwater a lot. It's a nice sized town, with the university. There's a lot going on, but it still has a small town feel, and it's ideal for us. So
Did Tulsa? It's interesting where people are from because um, this is a perfect sized town for me. Biggest town I've ever lived in is Springfield, Missouri. It has
gotcha.
a couple 100,000 people in it.
Sure.
But Tulsa to some is a major city, to some it's not. Tulsa reminds me of Springfield, only twice the size.
I
Does that
gotcha.
make sense?
Yeah, Tulsa. I mean, Tulsa's a good sized city. I actually, in junior high and all the way through high school, actually lived outside of Washington D.C. With my parents, growing up, and so I got used to, big, that's pretty big city, and so
So did you ever think politics might be in your blood?
I find politics very interesting. I follow politics, without, getting into specifics. But I do pay attention. I think that's important for everybody. But I never really considered going into, politics myself. Uh, you know,
You want to be a difference maker here. Yeah.
I would say, like my father was a local
Right.
politician on and off, and I don't think he envisioned going into politics necessarily until people started kind of tapping him and,
Right.
talking about, hey, maybe you should get into this kind of thing. So that's how it happens for a lot of people.
Yeah.
Uh, so
With your family practice right now, what's a typical day? What's today like?
what's the day like? Well, I'm gonna start go see patients. I usually start at 8 and see patients all the way up till about 4:30, 5 o'clock in the afternoon, and that's typically my day. For the most part, I am getting set up to see my own patients in the hospital currently. So if I have a patient of my own that I end up, needing to admit to the hospital and things like that, I'll see them there as well. But I haven't quite got that all kind of ironed out yet. So, but still seeing patients in the clinic.
Did you have to do telemedicine also?
Oh, I do. I am set up to do some telemedicine. We did a lot of it in Tulsa in residency when COVID was first, coming out. We did a whole lot of it. But I am set up to do telemedicine and can if that's what it needs. With telemedicine, I'm happy to do that. For a lot of visits because it avoids unnecessary contact and exposure, especially for somebody that may have a condition of some kind. An underlying health condition that increases your risk of having a bad outcome if you had COVID. But I like doing telemedicine if it helps people out. There's certain things that I might see on telemedicine and say, hey, I might actually need to take a look at that,
Right.
and then need you to come in or something like that. But for the most part, especially for kind of ongoing kind of chronic conditions, telemedicine's a good
Now,
solution
did the
for that.
laws change some because
Yeah,
of COVID? Because
um,
they kind of forced their hand, right?
yeah. So insurance and Medicare and stuff like that have kind of changed how they allow us to have visits and stuff like that and bill for those with having telemedicine. They had to make some changes just because of the pandemic situation and more people. We don't want people to not be able to speak with healthcare providers and that kind of thing, but also don't want to obviously taking sick people and putting them all in one place isn't always a good idea either when you're trying to limit spread. And so luckily they've kind of changed how that works, and it's a lot easier to get those visits done.
Now, as a family doctor, you cover everything.
I do. I see all ages, a little bit of everything.
How often does COVID come up? Not that they come to you because they may think they have it, but just the conversation, discussion, picking your brain because we all want to know. I mean, I had somebody. Okay, I'm going to ask you a COVID question,
Sure.
right? And this is not fair at all.
Okay. Well, I'll answer it as best I can.
But with what's going on at West Haven, we've been so pleased uh, and so far thankful and blessed that the fact that when you hear that it gets into a place like that, the first thought is, uh-oh, what's next?
Right.
Because you don't know whether they can. You think like I have a mom in her 80s.
Sure.
She's not she's doing really well, but I haven't gone home since February because you're afraid. Okay, if they get it, they're already vulnerable.
Right.
And they're already compromised. Will that be the end for them? And we're seeing the fact that that's not been the case out there. They're getting good results. And are there different strains?
Not to my knowledge. To my understanding, and I haven't read up on this, to like any extent. I'm not an epidemiologist or anything like that, but
That's why I said it wasn't a fair question.
I'm not aware of new strains. There's been talk, and I'm sure they're looking and researching for those, but I'm not aware of multiple different strains, kind of like you see with the flu and things like that.
Right.
Not to say that may not be the case later on. I don't know, but to my knowledge, no, there's not.
But when you hear
another
it being
strain
in a
that we're
place
looking
like
at.
that, you fear the worst right off. And so far, I think they've done an amazing job out there.
I think they're doing a good job from what I hear. Obviously, I'm not directly involved in the care over there, but they seem like they're as best you can be in a situation like that. It's people that are dependent on care of other people to live. That's a situation where you can't limit contact very well. It's just a hard thing to do, and so I think they're taking care of them as best they can.
Do people pick your brain about when they come in? Pick your brain about
Sure.
COVID all the time?
Oh yeah, every day.
What do they ask most? You've been asked about the strain thing, I bet, before, right?
A lot of times they ask me, if I think, when is there going to be a vaccine is probably the biggest question that I get, kind of the most. I get that a lot. The answer is I know they're working on it. I'm not going to try to prognosticate when that's going to happen. I think that they're working on it is all I can tell people. Trials are underway, I know, but I don't have any, kind of special information more than that.
What about the upcoming flu season, the regular flu season? What are your thoughts about that?
I think it's extra important this year to get a flu shot is what I would advise everybody to do. The flu vaccine is shown to be helpful. It does not cause the flu, common, kind of misconception. And this year especially, it would be advisable for you to, not get COVID and the flu at the same time. That could be, that's not going to be very good. I've actually seen that personally in residency.
Really?
Yeah, at the end of the very beginning of COVID, was still kind of the end of the last flu season. And so we saw more than one patient that had the flu and COVID at the same time and were hospitalized as such. And so it can, it's just if you can eliminate one less thing, that's what I would advise people to do.
When is the best time to get that?
Right now, I believe the CDC is recommending that you get your flu shots in ideally before the end of October, and so we're starting to get flu vaccine, I think, here in town without specifically knowing when and where. And I believe my clinic is going to start offering it sometime in the beginning of October.
Okay.
So we should have some there, but you can, the health department should be rolling some out sometime soon if they're not already. And then, your pharmacies and stuff like that often have it as well. So doesn't matter where you get it, just get it somewhere is my advice for people.
Very good. I'm going to get a brief break in here, and then we'll kind of do a recap and everything.
Sure.
But Dr. Drew Anthony is in, and you've been in town. What'd you say, a month?
I've been practicing for a whole 4 weeks now, I think, coming up there anyway. And it's we're getting used to it. Every time you change practice, it's kind of a trial by fire a little bit, but it's been good.
We'll get caught up, and we'll go over the address and to what you need to do to get in touch with the doctor.
All right.
And you probably just reminisce here. We'll take a time out. Our show brought to you by Simmons Bank, and on Wellness Wednesday, always brought to you by our great friends at Stillwater Medical Center. Back after this.